Community health centers provide a neighborhood medical home that is both high quality and lower cost. They are more than just a doctor's office. They are a place where a child can see a pediatrician, an adult can see an internist. You get dental care, mental health services, or prenatal care. You can go there when you're getting a cold instead of running up big costs at an emergency room. The doctors, dentists, nurse practitioners are under one roof, and they coordinate your care, working as a team, for your family's health in a one-stop wellness center. And the costs per patient are far, far below the cost one would pay if you went to a hospital or private practice. That coordinated effort saves a lot of money through preventative care, keeping you up with immunizations, and providing quality medical intervention when you need it at one of these 1,250 nonprofit community health centers. In our nation's $2.4 trillion healthcare system, the community health centers are credited with saving nearly $25 billion each year. Families save money, and Medicaid saves money. On average, a person using a community health center saves $1,100 per year on health care costs, according to a recent study by George Washington University. That's the good news. The sad news is that there is a serious shortage of health care providers at these centers, and no matter how great the center, or if there are long delays because of the shortage, then health care delayed is health care denied. Health centers located in medically underserved urban or rural areas report a 27% shortage of dentists, a 26% shortage of OB/GYNs that are providing prenatal care, and a 13% shortage of family physicians. The centers simply do not have enough money to hire the additional staff required to cover the growing patient needs. But there's an answer. Many health professionals, especially part-time workers or highly qualified semi-retired medical providers, are willing and able, but not allowed to do so. That's right. They want to volunteer their time, but they cannot. They cannot because the centers are not able to cover the costs of medical liability insurance for the doctors and nurses. Medical liability insurance can cost tens of thousands of dollars, or in some cases well over $100,000 per year per doctor, and the clinics simply cannot cover that expense. Here's why. Practitioners employed by the community health centers are covered by the Federal Tort Claims Act, which extends federal liability protection to those volunteer doctors. Oddly enough, the opposite applies at free clinics, where volunteers are covered by the FTCA, while those who are employed at free clinics are not covered. The Congressional Budget Office said that medical liability insurance costs pose a, quote, significant barrier, unquote, for many providers who otherwise would be eager to volunteer at health centers. This bill, H.R. 1745, fixes the disparity and opens the door for volunteer providers at clinics all over America. This bill, which I introduced with Representative Gene Green, will eliminate the barriers for millions of patients seeking care in these neighborhood health care homes and will allow thousands of practitioners to volunteer their expertise for high-quality, low-cost patient care. The Congressional Budget Office estimated the cost of this bill would be as little as $5 million a year for 5 years, and in return, clinics receive hundreds of millions of dollars worth of free health care services for those living in underserved communities. And because this funding is part of the health center's program annual appropriations, this funding is not scored cost. The dedicated health center fund means that the slight additional cost of the FTCA program will require no new appropriations. I repeat, the slight additional cost will require no new annual appropriations. I'm grateful for the support of my colleagues, Representative Gene Green, Frank Pallone, John Shimkus, Phil Gingrey, Ranking Members Joe Barton, and Chairman Henry Waxman for working with me on this legislation, and also my staff, Brad Grants and Susan Moseychuk. Mr. Speaker, we are in Congress, and we have a chance to do something to expand care to millions of Americans with this act without raising the health care bill for families. This is an example of real bipartisan reform that helps people get the health care they need when they need it, close to home at an affordable cost. But isn't that what we all want with health care? So let's say yes to community health centers, yes to families, yes to doctors who want to volunteer their care, yes to affordable and accessible care to millions of families, and please say yes to H.R. 1745, the Family Health Care Accessibility Act. And I yield back.